Hey, everybody. Welcome to MedKit's Provider Spotlight, where we interview really amazing private practices from all over the United States. And today we have a really awesome guest, Dr. Schiffman from Miami Skin Doctor. He is a board certified dermatologist in the Miami area, and we have the pleasure of talking to you today. So appreciate you being our guest.
Thanks for having me, Rachel. Appreciate it.
Yeah, definitely. And so let's kind of get into the meat of things. I feel like everyone has a story. Everyone has a way that they got here, a path that they chose. So what is yours? What is your story and what inspired you to open up your own practice?
Well, I grew up in New Jersey. My father was an optometrist, so I grew up with a doctor's office in my basement, and I had patients ringing a doorbell when they wanted to see him. So I sort of grew up with that sort of thing, and I figured I wanted to be a doctor. Usually, you follow in your parents' footsteps. I also had an interest in science and biology and all those different things. And I eventually went to University of Miami where I studied microbiology. I thought I wanted to be a doctor, so I went to medical school. I went to medical school back in New Jersey and I wanted to do infectious disease. So I taught about microbiology, and that's what I majored in college. That's what I studied, and focused on in medical school. And then you start to do some rotations and things like that. And you go into infectious disease and you go into other specialties like family practice and pediatrics and OBGYN, and you really decide what you want to do. At that point, I said, this is infectious disease is not something I wanted to do because it was a little too hospital based and things like that. But it also, still had things like bacteria and viruses and parasites and fungus and all the things that are fun with microbiology. And the one thing that I knew that I could do and still be in that particular field, and not have to be in the hospital and not deal with acute, urgent, emergent, you know, things that might cause death, right away. That wasn't for me. I wanted to be in an outpatient setting. I wanted to deal with things that I can treat easily. I wanted to be able to see things and diagnose things and do simple procedures without having to deal with lab work and very, very sick patients in the hospital. So dermatology lended itself to a little bit of microbiology, a little bit of infectious disease, but outside the hospital where I could be in a private practice and away from very, very sick patients, because not all doctors have to deal with very sick patients all day long. And I just wasn't really into that.
No, I hear you. And that's really cool to hear about your dad. And, I'm sure he was a great role model and, you got to
Yes,
see a lot during that time.
yes. My father was a wonderful optometrist. May he rest in peace. But he was the one who stimulated me to, go down this route of being a doctor. I don't really know what else I would do. If I had to do it again, I probably would be in the same position. But becoming a dermatologist is not necessarily the easiest route. It actually is one of the hardest specialties to get into. And the one thing I'll tell you is that it really doesn't matter what you want to do as a doctor. You can always do what you want to do. It may take you a longer time to get there. You may have to take shortcuts or even longer routes around to get there. But if you want to do something, you can make it your business to do it as a doctor, although it is very hard to get into residencies. And my way of becoming a dermatologist was I went to work with a dermatologist up in Pennsylvania for about 5 years by the name of Dr. Stephen Schleicher, and he's one of my mentors, and he taught me a lot of dermatology. And then I actually went into a residency after working with Dr. Schleicher for a few years. So I trained in dermatology post medical school for about 8 years,
Wow.
which is usually a 3 year training program. I trained for 8 years doing a fellowship and then a residency. So in 2009, I came out of all my training, which occurred in Pennsylvania, New York, and New Jersey. Then I moved to Florida. I joined the practice. I worked with the practice for about 2.5 years and then decided I could not work with anybody or for anybody. And I just wanted to work on my own. So I started my own practice.
That's awesome. I love that story. See, this is why I poke a little bit because I love the answers and I think it's always inspiring, for your dad to, working, with this mentor that you had for so many years before you even went into residency and all that experience gave you your baby. It gave you,
Well, that's
your
the whole thing. I mean, you get a chance to work in a hospital setting, and you could say this is something I like or something I don't like. I didn't like that at all. You can work in many different offices, and you can take a little bit from each doctor that you work with. Fortunately, in a robust residency like I was in New York, I was able to work with some of the top doctors all around the New York area. So I went into Manhattan and Long Island, and I worked in many different offices, and you take what you want from those offices and you leave the things that you wouldn't want to do, or the ways that certain people practice that you wouldn't want to do. And that's really where you get the experience to be able to say, you know what, now I'm ready to open up my own place because I know what I want and what I don't want based on the amount of experience I've had. And hopefully you can create a practice that's really unique to you and based on your experience. And that's hopefully what I've done. So I've been in practice now for about 10 years on my own here in Doral. I work by myself. My wife is a physician assistant. She helps me run and administer the practice. I have a relatively small staff of about 4 people that work with me, but we see, close to 175 patients a week. So it's a pretty high volume office. And I treat all disorders of the skin, the hair, the nails. I'm a general dermatologist. A lot of misconceptions about dermatology is that it's all glamorous. It's everyone making everybody beautiful and doing Botox and
yeah,
fillers and lasers. But I personally am a clinical dermatologist, medical dermatologist first and foremost. There are few of us left. I mean, some of us are in academic settings and teaching settings, things like that. I do teach in my office. I have residents in dermatology, family practice, physician assistant students, and even pre-medical students who are interested in working with me. So I teach. But there are a lot of dermatologists that like to just dabble in the cosmetics because that's where the cash is. It's a
yeah,
cash business, and that's where you can make some money. I do cosmetics and I enjoy it, but my mind is stimulated more from the medical.
yeah,
Financially, that's not the best thing, but I can't change the fact that my mind thinks a certain way and I have certain interests.
yeah.
And
But
so
not there's
helping
also a
people with
truth.
their, psoriasis or acne and curing their chronic issues with their skin, and helping them feel better about themselves is, I guess, more meaningful to me than making somebody's lips a little bit bigger temporarily or helping their wrinkles for a few months, which I do, and and then many people come to me for it, but I prefer to cure your chronic disease with the knowledge that I have.
100%. And I love that you clicked on that a little bit more because I think, yes, when we talk to dermatologists, it's all over social media, this, that, a lot of the cosmetics, instant results. But I feel like we need to talk a little bit more about the medical side of things. And so, if you don't mind, why don't you tell us some of the most common areas of, what you treat or you find maybe the most that people are struggling with? Like what is really hot right now in your
Sure.
practice medically?
Well, by far, the most common condition that I see and treat in my office, whether it's here in Florida or New York or New Jersey or Pennsylvania, is something called seborrheic dermatitis, which is the layman's term, which is the medical term for dandruff. So
Yep.
dandruff. So flaky, scaly scalp, flaky, scaly nose, face, T-zone, those things. That is by far the most common thing that I see.
Mm,
And you'd think that someone would have a cure for that by now, if that was the case, because I'm sure I'm not the only dermatologist that sees this, but there is not. There's many different treatments for it. It's hard to treat. A lot of it's due to stress, but that's the most common thing that I treat. And dandruff is not glamorous at all. It's scaly scalp and all it is, but it's the most common. The second most common thing that I see, is acne, pimples. So uh, people develop pimples, teens, women, unfortunately, at the short end of the stick, they deal with it in their teens, their 20s, their 30s, their 40s, even into their 50s. Sometimes women deal with acne, hormonal reasons, diet reasons, weight reasons, all these things, and obviously hormonal like teenagers. But acne, varying from very mild acne to the severest forms that require things like isotretinoin or Accutane, are another big problem that we see here in the office. In addition, we see things like psoriasis, which is a chronic autoimmune disease, which very, very thick plaques that people suffer from. I also see patients who have viral conditions like warts, including, hand warts or genital warts. We see things like hair loss, alopecia areata, which is, coin-shaped hair loss from stress. Autoimmune conditions like vitiligo is common as well. And rashes, which are,
Yep.
there's many different types of rashes, but people come in with poison ivy or eczema or something called atopic dermatitis, which is a chronic itchy condition of the skin which causes chronic rashing. So those are some of the main things, and also nail fungus and things like that. So those are the main things that we see. And I also deal with skin cancers, things like basal cell carcinoma, squamous cell carcinoma, and even malignant melanoma, which is a very deadly form of skin cancer. So the most common skin cancer we see is something called basal cell carcinoma, or pre-cancer. It's called actinic keratoses, and that's due to the sun. And in Florida, whether you're in Florida or Long Island, or even in Alaska, I mean, there's skin cancer. People
Does
are
not
prone to it.
discriminate.
Yeah, if you're fair skinned, you're light eyed, you burn rather than tan, and your parents had skin cancer, you're going to have skin cancer. So it's important to, with those risk factors, to be seen on a regular basis. So I do see people on a regular basis, not just for those rashes and those things we just talked about, but also for general skin surveillance. I have a history of this, or I have a bunch of moles and I need to be seen on a regular basis to check for skin cancer. And if I see people, yearly or regularly, those are the ones that I save their lives. And even though dermatologists, you think that everything's beautiful, we do save lives sometimes. And when I diagnosed a melanoma on somebody who came in because they didn't like the little broken blood vessel on their nose, I feel better about saving their life from their melanoma than getting $100 and something to zap something on their nose.
Yep. Well, it's interesting. I'm sure a lot of people come in and they're like, hey, I'm coming in for maybe the psoriasis or whatever. And you're like, hey, let's talk about actually the melanoma that's like sitting right there in your face.
Well, that's what I do. So some people come in and they like, I have a pimple here. And I say, well, let's not talk about your pimple for a second. You have a syndrome called dysplastic nevus syndrome. You have moles all over the place. Have you ever seen by a dermatologist? No. Okay, take your shirt off. Great. There's a melanoma on your back. Let me save your life today, and then we'll worry about the pimple. I'll give you something for the pimple too, but I'm not worried about that. But that's what separates me from, let's say, a physician assistant or nurse practitioner. No offense to those fields, they're very, very helpful, but I've been doing this for 20 years. And I have seen people that have come from other places. And if you don't have the training and the knowledge like a board certified dermatologist with years and years and years of experience, those are the things that you'll miss. You won't look. You won't know how to recognize it. And you'll lose those things. And unfortunately, some patients will die and they won't even know why, but there was a melanoma that was missed. So for me, if you're going to come to me, either the first or second time I see you, I'm going to be looking you over. Even if you came in for a mole on your face, I'm going to ask you to take your clothes off at some point for me to look you over from head to toe. Because if you have one mole, you have other moles. And the last thing that I want is to have somebody that's in my practice that has a melanoma that I didn't find or didn't see, and I've been treating them for something else this entire time.
Yep.
That would destroy me as a physician. You know what I'm saying? To say, okay, you know what? This thing has been growing there for years and I never looked. So I always try and look. And then if I look and I know that you don't have the risk factors and most likely you're not going to get a skin cancer and I'll have to follow you, then I'll focus on all these other little things that you have.
Yeah.
So for me, the skin is the largest organ in the body. If you look, you can see what's going on. If you don't look, you'll never see. In fact, I'll tell you a story real quick. My first patient in my residency in a hospital-based setting, they called me up and they said, Dr. Schiffman, we have somebody who came in. He was a healthy 65-year-old man who came in with his wife. He was anemic. He looked pale. He was bleeding from the rectum, right? They did a CAT scan. They showed he had tumors all over his liver, all over his lung, and his lymph nodes. They took out one of the lymph nodes, they cut it in half at the pathology. They saw there was a big black mole there. They said this patient has melanoma. Dr. Schiffman, go down and look at him, look his skin over. We want to find the primary site. So I went down to the emergency room, he got undressed, and I spent the next 20 minutes looking him over. Every nook and cranny, his head, his scalp, his ears, his mouth, his eyes, all over, his legs. I couldn't find a thing. I said, turn around, spread your butt cheeks.
Yep.
And the melanoma was right in the middle of his ass crack, right? right at his crack. And that's where it is. And that's where you have to look. And you have to look in places where you normally wouldn't look to find the things that ultimately may save somebody's life. So,
and that's
unfortunately, his was way advanced, and this was at a time when we didn't have the same types of treatments that they have now for melanoma. And unfortunately, he passed away. My first, melanoma patient. But I did find the primary site on him, and it took looking in his butt crack. So now every patient that comes in, I ask them, is it okay if I look? And I look, and if there's something there, we get it, and if not, I just make sure there's nothing there.
But I think that's really smart. Obviously, learning from experience, but it can happen. And I love your whole approach, holistic. Let's take a look at everything.
Well, I'm also an osteopath too. I'm also a doctor of osteopathic medicine, which is different than an MD. A DO is a whole different form of medicine in the United States. I don't know if your listeners are aware of the difference, but there's two ways to become a doctor in the United States. There's becoming a medical doctor, an MD, which is called an allopathic school, and a DO, which is an osteopathic school. Osteopathic schools maintain a philosophy that we treat the body as a whole. And it also incorporates things like chiropractic things and body manipulation. I don't do that particularly in my personal practice, but the philosophy is if your body is in alignment and all of the bones are in alignment, then all of the tendons and the nerves and the joints and all of the blood flow and the lymphatic flow and the nerve impulses will all flow unimpeded, right? When there's a tweak in your neck, then everything is sort of hits a roadblock, and that's where you have problems and pains and things. And so if your body is in alignment and everything is perfect, and we can help you by manipulating your body, stretching and swimming and different things like that, then everything we do for you should work better. Your system, your machine, your body will work more efficiently if your body's in alignment. So that's the philosophy of osteopathy. It does, and it can relate to any specialty. There are certain things in dermatology that if you do some manipulation or swimming or things like that, that can help. There's things like postherpetic neuralgia or notalgia paresthetica. These are nerve irritations that cause certain things and certain pains. And, there is an element of manipulation and body mechanics that do go with certain dermatological conditions. And you're right, I treat more holistically. I treat the whole patient. If someone comes in and they have a problem with what's called stasis dermatitis, which is chronic edema in their legs, which causes brown staining and blood, and redness on the legs. Well, you got to lose weight. You got to take all the weight loss off. I can't really help you too much unless you lose 100 pounds, 200 pounds. Fortunately, we're living at a time where you have these whatever they call them, the GL inhibitors that help with the weight loss. And so I'm seeing patients who are 300 pounds coming in 150 pounds, you know what I mean, now. And these are really life-saving medications. But the body, you really need to treat the body as a whole. Psoriasis is very highly associated with smoking and obesity. So if someone comes in with psoriasis and they're 400 pounds, we put them on weight loss because then they'll have less of a risk of psoriasis. If someone comes in and they're smoking, they have to stop smoking, or else nothing I'm going to do is going to help them. So we try to not just treat the illness specifically, we try and treat the whole patient, let them know what they need to do in order to make their disease most likely to go.
Sure. There's other factors that go into it. And speaking of seeing the whole picture and how you treat patients in office, but also telemedicine, right?
Correct. So I was one of the first dermatologists using telemedicine. In fact, I was the first teledermatology fellow in the whole country. And I did this with Dr. Steven Schleicher back in 2001.
That's
And in 2001, what we were dealing with was, number one, we weren't dealing with cell phones with pictures.
awesome.
We weren't dealing with Palm Pilots at the time. We were dealing with an actual phone, a fax machine, and emailing pictures through the internet.
Yeah.
We also had video conferencing with big, huge tube TVs and a big camera on the top.
Yep.
I used to do telemedicine with the federal prison system in Allenwood, Pennsylvania, Philadelphia, and Lewisburg. And the way that I started telemedicine at that time in 2001 was, instead of going into a prison, dealing with the security that you had to get
Yep.
in, get out, very, very stressful for the doctor, very difficult for staff. Instead of having the patient be transported in a van with 2 or 3 security guys in chains to sit in your waiting room,
Yeah.
we triage them through telemedicine. So the provider in the medical facility in the prison would take a few pictures, fax over the information about the patient. We would review the pictures, help, and then we would talk to them on this video conference once a
Yeah.
week or once every 2 weeks, where the patient stayed in the prison. We would say, I reviewed your pictures, I'm seeing what's going on, and we would tell the provider what to do with their formulary and their medications, because prisons are different. They don't have the same access to certain medications as we do
Sure.
on the outside. So we would have to adjust the treatment specifically for them. And that's how we did it then. My dream, when I was doing that a long time ago, I said, wow, wouldn't this be great if I could be sitting on the beach? And yeah, it doesn't really sound good as a dermatologist, but I do like this. That's why I live in Miami. That's why I have my family here. But I wanted to be able to be doing my thing, get a beep on my phone, almost like a pager. At the time, we had pagers, but I'll get a beep on my phone or device, get a picture, dictate it, send it out, and be done with it. I can do that now. I can do
That's
that,
awesome.
but it's not the most fun thing, and it's not something that I want to do all the time, because it's not as easy as seeing somebody in person.
Sure.
And sometimes you can use telemedicine, but for certain things, and sometimes you can't. For lesions like moles and things that you think about skin cancer, it's very difficult to see something. I have special lights called dermoscopes where I have to look very close in the office, and if I didn't have that, I wouldn't be able to do my job. But you can't do that through telemedicine unless someone takes a very good photo, and it's hard for people to take good photos of their skin unless they know, or you have to have very close-up pictures, and unfortunately the technology doesn't really provide it unless you have certain attachments and things like that. So when someone comes in and they become an established patient, and I get an idea of what's going on, I decide whether or not I can see them through telehealth. It's also good for kids, teenagers, kids who are in college, chronic issues, who I have to see them monthly for Accutane or antibiotics. You're going to school, everyone has a phone now. I can connect with them immediately and send everything out electronically. I use an electronic health system called Emma through Modernizing Medicine. Everything is done electronically, electronic prescriptions. I get pictures, I do video, and I do telemedicine once a week with usually my acne patients, who can't get here because they have school or after school activities. I don't like to work very late, for whatever reason. I like to start early and work early. I don't like to stay very late. So it limits my my acne and teenage patients, to either getting here on the earlier side or doing telemedicine. So it helps. It also helps with parents who have little kids, who just had a baby and can't get around. It's very difficult. There's Miami traffic. There's a lot of stuff that goes on. So we use telemedicine to bridge that gap. And also, if you're an established patient and you have an emergent thing and you happen to be somewhere else, hey, send a picture to me. If I can send it to you and help you out immediately, that's
Why
how we
not?
use it. Yeah, so
I
it's a
love
nice
that.
little service that we provide, and the technology is amazing. And sometimes you look at a picture, sometimes you do a video, sometimes you do a combination of it. But if it's something that can be done immediately, urgently, and you can get the care that you need without having to worry about waiting, or driving or dealing with traffic.
No, I love that. It's accessible. I think that's like
Absolutely.
the best word for it is that, no matter where you are, what you're doing, if you have a concern, you can make an appointment and boom, like if there's a way, a good path to moving forward to doing things electronically where, they can sit at home, you can be wherever too, and still be seen, still be seen by a professional, get really great advice, have a path forward. I think that's amazing. And especially about, seeing things, you know, what should people, I'm sure a lot of these emails might come through, right? Hey, I'm concerned about this, but what are the actual signs people should be looking for with the real, whether it's melanoma or, what are the true signs?
Sure. Well, when we talk about melanoma, usually, and not all the time, because melanomas can really look like anything, but there are general classic signs that we look for, and we use a mnemonic called the ABCDEs, right? So you can have moles or what we call nevi or congenital melanocytic nevi would be the term for it. And people can have general benign moles, and they can also have something called dysplastic nevus syndrome, where they have sort of different color, different size moles. People who have dysplastic nevus syndrome should be seen on a regular basis by a dermatologist, or anybody who has moles, they should be seen just regularly just to get an idea of what's going on, because it really takes a trained eye to be able to see the differences. But for you at home, we like a mole that's nice, round, symmetrical, one color, you know what I mean, even, and stays stable. If you have a mole that's growing, that's a problem.
Yeah.
If you have a mole that's changing size, shape, or color, that's a problem, right? But specifically, we're looking for things that are asymmetrical. One side's not like the other, right? B, borders that are irregular or jagged or look like little finger-like projections coming out. That's
Yeah.
bad. C, color changes. Half side's brown, half side's black. It wasn't always like that. That's a problem. Half side's brown, half side's white now. That's a problem. It's red, it's green, whatever color if it wasn't that before, that's a problem. If it was small and now it's big, that's a problem. If it was big, now it's small, that's a problem. If it's evolving, so asymmetry, border irregularity, color change, diameter growing, or evolving, anything changing. So moles shouldn't change.
Yeah.
Okay? It shouldn't. Once they're there, that's the way they should be. If they're changing, that's something you need to be evaluated by. Um, by a board certified dermatologist, ideally. There are other types of skin cancers besides melanomas. There's things like squamous cell carcinoma, which are usually scaly red wart like plaques. They're usually found on sun exposed areas like your face, your neck, your shoulders, your arms, your lower legs, right? A lot of times people come in, they have the most common form of skin cancer called basal cell carcinoma, which is a little pearly pink bump on your skin, sometimes a non-healing sore, any bleeding area that on your nose or your ear in somebody who's older with sun exposure and sun damage, that's a problem. Things should heal, right? You cut yourself, it heals. If it doesn't heal, there's something wrong with you or there's something going on, right? And so you'd be surprised, people come in and we get them undressed, and from their neck up is brown, from their short sleeves down is brown, from their knees down is brown, but everything else is as white as a baby's butt. And the skin cancers aren't in the white areas,
Yeah.
they're in sun exposed areas, right? So that's why it's important to use a sunblock with an SPF of 50 or higher, and use things with zinc and titanium, which are blocks, and reapply them. And there are certain people that need it more than others, right? If you're fair skinned, you're light eyed, you burn rather than tan, you have family history of skin cancer or personal history of skin cancer, then yeah, you're somebody that really I don't want to see on the beach too much.
Yeah,
Okay.
for
You know what I
sure.
mean? But if somebody like me who tans and doesn't burn and doesn't have any moles and likes the sun and feels good in the sun, yeah, you can go to the beach. You can have fun. It'd be better if you use sunblock, and there's always risks of skin cancer, but you don't have the same risk factors as the guy that hero has dysplastic nevus syndrome. He has 1,000 moles. He's had 100 biopsies. He's the guy that really shouldn't be in the sun next to you,
Yep.
but you'll see them anyway. You'll see them there. And in fact, you know what? This weekend, I was just with my family up at Lake Oconee, and I really never do this. It's very, very rare. But I was walking up the stairs, and this guy was in front of me, and he had his shirt off, and he had a really funky looking mole on his back. I mean, I'm talking funky, and I don't really say anything unless I really think that there may be something going on there. And I said, "Excuse me, sir." I said, "I really don't normally do this, but I am a dermatologist, and I'm just curious. You know about that mole on your back, right?" And he's like, "No, what mole?" And I'm like, "Oh, okay, great." You know what I mean? I'm like, "Well, you got this really funky looking mole. It's real dark on your back." I'm like, "You sure you've never seen that before?" He's like, "No." I'm like, "Well, do me a favor. When you get done with the vacation, go see somebody. And he was, very appreciative of it. And, hopefully he'll get it checked out. And hopefully, maybe, hopefully it won't be a melanoma. But if it
Yeah.
is, maybe he'll say, wow, that guy saved my life. Maybe.
Saving life. You should go to the beach more often. Save some more
Well,
life.
that's the other thing. I can go to the beach and give my card around as well on South. That's where I live. I live on South Beach. I'm on the beach all the time. I like the beach. We need sun. All right. Don't be afraid of the sun. Okay. Even
Yeah.
patients who have had skin cancer and atypical moles, I say, don't be afraid of the sun. You need sun to create vitamin D. Okay.
Yeah.
You need that. And then there's a whole, lack of vitamin D. You know what I mean? I checked my vitamin D the other day. It's on the low side. I have the biggest tan of any dermatologist down here. And my vitamin D is low. I don't get it. Nonetheless, sunblock is important for people who have risk factors, who people are out in the sun all the time, who people who work outdoors. We're in a big city. You have dock workers, airport workers, postal workers, electricians. These are the guys that come in with skin cancer.
Yeah.
And those are the guys that no matter what, if you're outside in the sun all the time, no matter where you live, you got to wear sunblock because it does decrease the risk of skin cancer.
100%. And to that point, and last question here, if there are a few easy tips that you think you could share, or maybe what you wish people would do, or what you maybe hear yourself saying all the time to patients,
Yeah.
and you
Okay.
sound like a broken record,
Okay.
what are
Okay.
those things for you?
Don't smoke cigarettes, number one. Smoking cigarettes is the worst, most disgusting, most unhealthy thing you could possibly do to your system. Smoking cigarettes, because smoking cigarettes will increase your risk of skin cancer, will increase your risk of acne, psoriasis, everything else. Smoking is the worst thing you could do. And we still have patients that smoke, and I smell it when they come in. They can
Yeah.
deny it all they want, but I see the lighter, I smell it on you, I know you smoke. Okay, that's number one. Number two, a lot of people are into supplements, vitamins, workout supplements, collagen, protein shakes. It's a total BS industry, in my opinion. Okay, that's just my opinion. Okay, if you have a well balanced diet, you eat well, meats, vegetables, you know what I mean? Fiber, you have a well balanced diet, you don't need any supplementation. They play on people's fears. This product is not intended to diagnose, treat, cure, or prevent any illness. The reason that they put that on is because it's not.
Yeah.
It's just somebody saying, take this and maybe your hair will feel better. Take this and maybe your skin will feel better. Take this and your muscles will increase, all that stuff. Well, the people who take those things are the ones that come in with the oily, acne prone skin, seborrheic dermatitis, because your body is trying to purge out all of this toxic stuff that you don't need, that is not necessary for a young, healthy young man or young woman. They take all of these things. They're not tested. You don't know where they're produced. Who knows where they're made? Who knows what other substances are involved in them? And the FDA doesn't follow these things, right? And so they don't know. And so things can harm things and harm people. And there are certain medications that are put into these things that can cause problems. And so I always ask, for the healthy young woman who comes in, who shouldn't have acne, who shouldn't have these issues, the first thing I say is, do you take supplements, protein shakes, vitamins, collagen? Oh, yeah, I take all that stuff. Stop. And they stop and it goes away. So
Wow.
that's a big thing. So smoking, supplements, vitamins, protein shakes, um, you know, those are the things I'm constantly talking.
Yeah. No, I love that. And I love how, really down to earth. I think a lot of us are susceptible to what we see online. Dr. Google, I'm sure you get a lot of those Dr. Google questions all the time.
Right, or Doctor Pimple Popper, and I go online and I see these. There's a lot of misinformation out there. You have a lot of people that think they know what they're talking about. There are a lot of people online that just because they went to a dermatologist a few times think that they know everything about the skin. They don't. Okay, I have been doing this for 20 something years. I still don't know everything about the skin. There are still things that I come in and I say, wow, this is really difficult. I've been doing this for 20 something years. I still don't know how to manage it particularly, but I have a couple of ways, to do these things, right? So, it's very, very it takes a long time to learn about the skin, and you need to get the information from the appropriate sources, and I always recommend you see a board certified dermatologist. If you go to a dermatologist or a board certified dermatologist, I would say 9 times out of 10 these days, you're not going to see the dermatologist. The
Yeah.
dermatologist won't be in that day. The dermatologist will be, I don't know what the dermatologist will be doing, but the PA will be there, the nurse practitioner will be there, whatever it is, the resident will be there, and they're going to see you, right? And they're going to see you for this. And obviously, if it's something bad, we hope that they'll say, "Hey, doctor so and so, this patient has something that's weird or unusual, and let me see them." But I don't work that way.
Yep.
I'm somebody that I see the person first. I see the person every time. And if I have a PA that's working with me, they'll see me first, and I'll decide whether the PA needs to see them. I don't do it the other way around
Yep.
because it's too important to me to not miss something. And it's too important to me to delegate somebody who comes in with serious risk factors to somebody who doesn't have the experience, the knowledge, and the wherewithal to be able to pick up these things. And
Yep.
that takes time, right? So you could be somebody in this for 3 years. I'm not going to trust you seeing my patients yet. I'm not,
Yep.
because it takes years to learn the skin and to know all the different things that you see. And I'm not saying that PAs aren't useful, they're extremely useful for basic things. But if you have risk factors and you have skin cancer, you need to be seen by a board certified dermatologist.
I love that.
You
And
need
if
to be
people,
managed by a board certified dermatologist.
yes, and if people want to see you as the board certified dermatologist, why don't you tell folks how to reach out to you? Because I know after this interview, you threw a lot out to people, and I think people would appreciate contacting you.
Okay, well, my practice is miamiskindr.com, Miami Skin Doctor. I am in Doral, in the pavilion at Doral. I am very close to the airport. You can check me out online, miamiskindoctor.com. I have a Facebook page. I have a Twitter handle. I have a LinkedIn. I have a YouTube. I have a couple of different things out there. I also do telemedicine. So if you're listening, and no matter where you are, if you check out my website, miamiskindr.com, on the bottom, there's something that says online telemedicine. You can click on that and it will connect you with me for telemedicine for any problems that you may have. Hopefully, it's something that I can help you out with, just by looking at a picture or a video. But anybody could get me literally today if they wanted to talk to me online through miamiskindr.com. So, I'm out there. If you're down in Miami, if you come by the airport, I'm about 5 minutes from the airport, so I'm pretty convenient. And I am the only one here. So if you're going to come to my office, you will see me and only me.
I love it. And I think that is the absolute perfect way to end our show today. If you want to see Dr. Schiffman, you are going to see him and no one else. And so I love that. Thank you so much for joining us today and really appreciate it.
Thank you, Rachel. I appreciate it. It's been a lot of fun.